Hi, it's Christina with the Sisyphean Journal. Today is November 2nd, and I want to address the claim that the Centers for Disease Control have any clue how many women and girls die from safe legal abortions. They publish their numbers as if they're reliable, but we only need one example of how slovenly they are. We just need to look at the case of Latache Vial. Latachi was 17 years old and 22 weeks pregnant when Robert Dale Crist performed an abortion on her at Houston's West Loop Clinic on November 2nd of 1991. Now, according to Latachi's family, she bled heavily at the clinic and cried out to staff for help, but they told her that her symptoms were normal and sent her home. And again, I've said this multiple times. Once that baby's dead, they lose interest. The woman is no longer their problem. Well, several hours later, Latachi stopped breathing. Her brother-in-law called 911 while her sister did CPR, but to no avail, and Latachi was dead on arrival at Ben Taub Hospital. Now, if her death certificate had been filled out properly with notation of the abortion in the proper box using the proper ICD code, theoretically, the National Center for Health Statistics would spot the abortion code and report it. But states only send a statistical sample of their death data to the National Center for Health Statistics. So the CDC would have been notified of Latachi's death through the National Center for Health Statistics only if the death certificate was properly filled out and if Latachi's death certificate was among the ones sampled and sent to the National Center for Health Statistics. Now, still, according to abortion defenders, Latachi's death somehow would have been magically reported to the Centers for Disease Control. Now, they're not clear on who's mandated to report this death. West Loop Clinic, Crist, Ben Taub Hospital, the medical examiner, Texas Department of Health. They say they get abortion death information from these sources, but reporting them is not mandatory. And think of it, if you're the abortion clinic or the doctor, reporting an abortion death is like turning yourself into the IRS for an audit. Who in the world's going to do that? Now, this doesn't mean that Latachi's death went entirely unnoticed. Latachi's family filed suit, retaining the flamboyant racehorse Haynes as their attorney. And the case was highly publicized both in Texas and in Missouri, where Crist had performed a fatal abortion on a 19-year-old developmentally disabled woman who'd been raped in an institution. And the mainstream publicity went beyond the usual newspaper articles. Crist gave television interviews, calling the publicity media hype and a political event. And Haynes retorted, I wish he would have a copy of that 911 tape. If he would talk to the parents, if he would talk to the sister as she gave CPR, or the brother-in-law as she was breathing her last breath, and see if he thinks it's a media event. Now, with all this mainstream media coverage in 2 states, the pro-life organizations picked up on it, and it was published in pro-life newsletters across the nation, from organizations like National Right to Life to little local ones. So a lot of people very quickly found out about the abortion death of 17-year-old Latache Vial. But what about the CDC? Well, let's jump forward to 1992, the National Abortion Federation Risk Management Seminar in Dallas, and I listened to a tape of this session, so I know what happened there. Crist spoke openly of Latachi's death. Now, of course, he didn't mention her name, but I'm assuming he's discussing Latachi's death since there's no evidence that he killed 2 17-year-old patients in 1991. Now, Crist blamed the death not on malpractice, but on disseminated intravascular coagulopathy, a clotting disorder sometimes triggered by injury or infection. Now, present at that risk management seminar, where Crist was chattering about Latachi's death, there were 2, count them, 2 staffers from the Centers for Disease Control's abortion surveillance activities, Stanley Henshaw and Lisa Coonan. Now, Henshaw's presence isn't quite as remarkable as Coonan's. It was Coonan specifically whose job it was to verify abortion deaths. Then once she verified it, she was supposed to get documents, the death certificate, any documents from the hospital, documents from the facility, and pass them on to a research fellow, Clarice Green, who would then gather more information about the case. Now, in spite of all the publicity, in spite of the lawsuit, in spite of the pro-lifers shouting it from the housetops, and in spite of Crist discussing it at an event attended by Lisa Coonan and Stanley Henshaw, the CDC did not note any women of Latachi's age range and race as having died in 1991. At Life Dynamics, we filed a request for information. They counted zero Black abortion patients in the 15 to 19 age range. In other words, they didn't even notice. I mean, they failed to notice this highly publicized death. It could hardly have been more obvious if Latachi had crawled to Atlanta, expired on the floor of Lisa Coonan's office with her aftercare instructions clutched in her hand, with the clinic name on it. But they didn't even notice. Didn't even notice. So how meticulous do you really think they are about counting safe and legal abortion deaths? I don't think so.